Well, it's time now for our Tuesday Health Report, and joining us now is Africa 54 Health Correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Well, the U.S.-based organization Corporate Council on Africa recently held a health forum with the theme Building a Stronger, Healthier Africa. The gathering included U.S. and African private sector companies, African health and finance ministers, U.S. government officials, and other key stakeholders. Among other things, participants discussed investment and development opportunities in the African health sector and leveraging lessons learned to build health systems. Dr. Isaac Malonza is country director of Jhpiego, Kenya, and one of the panelists. He elaborates on some of his organization's strategies in improving health systems.
In strengthening health system, the first thing that we need to look at is are the governments investing in half in terms of the health budget at an annual level. In Africa, there is a recommendation called the Abuja target that African governments committed themselves to invest 15% of their annual GDP into health. Currently, many countries are still below 5% of that investment. Staff shortages is a major issue, so focusing on training, pre-service education, getting enough healthcare workers to be able to deliver the services that we want is extremely important. And then once you have that, you then need to focus on the package of services that healthcare workers need to be able to deliver, quality health services. That the other missing challenge is we do not have facilities in some of the hard-to-reach areas in Africa, and that's something that my organization has been focusing on and working with the ministries of health to be able to get the healthcare workers and the system to respond to the hard-to-reach areas. So either through outreaches, mobile facilities out there, or what we call reverse referral, where we get highly expert doctors to be able to periodically work in rural areas so that they can be able to deliver those services.
Now, Dr. Brima Kargbo is Sierra Leone Chief Medical Officer. He says a weak health system and other factors were detrimental in the onset of the Ebola outbreak in his country.
When it hit Sierra Leone, it was there for a few weeks before the health system actually got to act. This was because the community systems that were there were not so strongly linked to the health system for them to be able to report. The second area also concerns our health surveillance system to be sensitive enough to pick up any of these abnormalities that may occur in any of the peripheral areas for rapid action. Of course, you don't forget the patient and healthcare worker safety. This is very important because in the initial period of the infection, we saw a mutual distrust of the populace to come to the health facilities, and also our staff equally were afraid of touching patients because they were not adequately prepared for what we were having there.
Joining us now in the studio is Dr. Faya Millimouno, a university professor and political activist in Guinea. Mr. Millimouno, welcome to Africa 54.
Thank you for having me.
So you were in Guinea, you live in Guinea, you were there from the very beginning of the outbreak. First of all, you came in the United States not long ago. Can you give us a sense of how things are right now?
Thank you for having me. I mean, in Guinea today, the situation is improving, thanks to everything that is being done by the international partners. The United States have spent nearly $1.5 billion to help those three countries. And thanks also to what the World Health Organization has been doing. More importantly, what the medical workers in Guinea, the heroes for us, because it is because of them, they were the first to pay the price, and they're still paying the price. The situation is improving, but you still have a lot of challenges ahead, because actually you still have new cases in the capital city area and the neighboring cities like Forekaria, Koya, and so on and so on. And you still have some resistance from people.
So after a year, we've seen that in Liberia, we can say perhaps there is somehow a success stories there, because today there's no new cases. But Guinea and Sierra Leone are still struggling with the outbreak. Tell us about how things are being handled.
I mean, the situation could have been better today if, from the beginning, good step had been taken by the government, by everybody on the ground. On the international side, you have to be thankful to the Doctors Without Borders, the World Health Organization, and many other non-governmental organizations that comes in to help. On the government side, we should know that at the beginning of the epidemic, there were a problem of trust between the government, and it is still the problem. People have the tendency to think that everything the government says is a lie.
Why is it so?
That's traditional in Guinea. You know, politicians in our country, the government in Guinea is used to lying people.
Okay, these are some very strong allegations. But we saw in the report earlier with Dr. Carbo from Sierra Leone, he also talked about the problem of trust, where the patients were a little bit fearful of going to the hospital, and even the doctors were scared of touching the patients. So trust is not just a problem of trust is not just the case in Guinea.
It's not just in Guinea. It's not just in Guinea. Is right. But here is the problem in Guinea. When you talk about Guinea, they tell you it is a French-speaking country. But you have hardly 20 to 30% of people speaking French.
So they speak in local language.
Local languages. Where the ground zero of Ebola happened in Jhpiego, in that village, I could say no 5% of people could speak another language.
So because we're running out of time, what are your suggestions? What do you think should have been done better, very quickly?
First, the government should not be in the position of denying at the beginning, because you have followed the situation, the debate. They denied at the beginning that Ebola was in Guinea. And today, when we see that the number is small, it should be taken very carefully. What should have been done is, from the beginning, to recognize that Ebola was here.
All right.
And also try to involve everybody, local leaders,
and regional,
religious leaders, and so on.
Okay, Dr. Millimouno, unfortunately, we're running out of time. There is so much more to talk about, but that's all the time we have for today. We have to leave it there. And that was Dr. Faya Millimouno. He's a university professor and political activist in Guinea.
Thank you.
Thank you for joining us. Now, that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.